Ladies and gentlemen, Dr. Franchescetti has got to catch a plane at very promptly right around the 2-ish hour level, and so he has to get out of here on time, and we want to hear all the good words that he'll be bringing to us. So if any of you end up with indigestion or even worse circumstances, we do have some physicians to take care of you. We will, in the meantime, hear Dr. Franchescetti, and we will have Dr. Waldy-Ackerman's Director and VP of the Program Committee to introduce him properly.
Thank you. It's a great pleasure to introduce Dr. Franchescetti. One of the hidden, at least for many of us, gems or great talents here in Edmonton. Originally from Edmonton, Dr. Franchescetti came within the University of Alberta Medical School and graduated with a combined MD, PhD in 1987. After graduation, he wisely entered a surgical residency training program with us, and perhaps more wisely recognized that it was more useful to prevent people from getting hurt than patching them months after. So with this in mind, Louis switched to specialty in trauma and preventive medicine, went to Johns Hopkins University, and earned a master's degree in public health. He has fellowships, that's specialty degrees, both from the Royal Canadian College of Physicians and Surgeons and from the American College of Preventive Medicine. In 1995, Dr. Franchescetti returned to Edmonton to work as an emergency room and preventive medicine physician in Rhode Island. He is currently a professor in the School of Public Health and adjunct professor in the Department of Emergency Medicine at the University of Alberta. He was the director of the Alberta Center for Injury Control and Research and is the founder of the Coalition for Cell-Phone-Free Driving. He's done a great deal of teaching and research into injury treatment and prevention, and has spearheaded numerous safety awareness initiatives. One of the very impressive research and treatment projects, at least to me, is the award-winning injury prevention program for teens called HEROES. Briefly, a teen who breaks driving laws, they have a sentence imposed that includes having lunch and spending part of the day with a person who suffered a broken neck or paraplegia while driving. Most teens accept that they will be killed if they have a driving accident, but very few realize that what likely to make them injured, especially when paralyzed and cannot even feed themselves. Dr. Franchescetti has given numerous lectures and received numerous accolades for his work on trauma prevention, such as Franchescetti approved the outstanding award from the Commission. In 2005, he was selected as one of Alberta's 100 physicians of the century. In June 2010, he became the president of the Royal College of Physicians and Surgeons of Canada, an organization that represents all medical and surgical specialties in Canada. In 2011, he was selected by Alberta Denver as one of Alberta's most influential people. And in 2012, he was nominated as the president of the Canadian Medical Association, an organization that represents all doctors in Canada. Ladies and gentlemen, Dr. Franchescetti, and he's going to tell us about the anarchy of the life of it.
Keep track of time here. So what I'd like to do is pretty well tell you everything I know in about 10 minutes, and then open it up for discussion. As what I don't tell you in about 10-15 minutes, hopefully your questions will stimulate some little gem that I can bring out at that time. What you're doing today, and I know that you do it monthly, is one of the things that I can guarantee you will make you very healthy. Getting together with the same people on a regular basis has been shown scientifically to improve your health. And that's why most of you look so good today, is because you're amongst friends, you feel comfortable, and you continue to share stories, and you continue to share the ups and the downs as well. Most of you know, and I don't have to tell you that, you've entered the best years of your life. If you don't think these are the best years of your life, invest in this book called Younger Next Year. They have a purple version for women and a yellow version for men. But that book basically tells you that you have just entered the absolute best years of your life. So that's something that I'm starting to discover, and it was reinforced when I was crossing the road when this gentleman came up to me and said, "Hey buddy," I said, "Yeah." He says, "I got a senior's bus pass for $10. You want it?" Like, why would he pick me to give me what's probably a stolen bus pass? But no, I said, "I'm okay. I don't need the bus pass." I'm going to try and simplify where we are in healthcare today, where we are as a province, and where we need to go. And if I sound a little radical in my thought, that's because I've been thinking about this for a long time, and it's really not more complicated than what I'm going to present to you. One thing I always got to do when I see I'm being recorded is make this disclaimer that I am not talking as president of the Royal College of Physicians and Surgeons of Canada. I'm not talking as president-elect of the Canadian Medical Association. I'm not even talking as a university professor. I'm just here to tell you a story. I'm an average citizen who happens to be a physician, who has an interest in healthcare, and I'm just here telling a story. So if you're going to try and nail me with anything, there must be a lawyer in this room. That should be a good enough disclaimer that I'm not going to get in trouble. Because every time I try and tell the truth, I end up getting in trouble. I offend some group that has a special interest. So if we to assume that we want, in Alberta, one of the richest provinces, in spite of what they tell us, in one of the richest countries in the world, I mean, we should be able to get it right. And if you want to get it right, it's not very complicated. All you have to do is, and I know we have a former senator here, go back to June 2009, read Senator Keon's report out of the Senate that talked about the things that really make Canadians healthy. And it's not the healthcare system. It's the social determinants of health. The things that make people healthy have got absolutely nothing to do with the healthcare system. But yet we've convinced people that it's the healthcare system that makes you healthy. The healthcare system may contribute 20% to your health. 80% of your health comes from being able to read, being able to write, being able to have a social network around you, being able to have some sort of education that allows you to have meaningful employment, that allows you to then pay your rent and contribute back to society. That's what makes you healthy, right? We need a healthcare system because we have so many sick people. And we have so many sick people because of 3 reasons. I'll teach you something that's very simple to remember. 3 risk factors account for 4 major diseases that tally up 50% of the healthcare burden. And then if you add mental illness or brain health issues, and you add injuries, of which Alberta has far too high number of people that are being injured, and you'll have about 75% of why people need to go to these healthcare systems. As an emergency physician, I don't know why they call them healthcare systems. I've never seen anyone come into emergency telling me they're perfectly healthy. So I think that's a misnomer. But the 3 things are smoking, inactivity, poor nutrition. It's not more complicated than that. Smoking, inactivity, poor nutrition. 3 of the areas that we teach very poorly in medical school. All right? Contribute to certain cancers, diabetes, cardiovascular illness, and sort of the chronic pulmonary condition, COPD. Now those 4 conditions account for 50% of the disease burden. And we're fortunate, Les, stand up, what Les wasn't introduced as, Canada's leading tobacco prevention control advocate. Les has done more for saving lives in this country than a lot of my colleagues and myself as well. Les is also spearheading an initiative on wellness right now with a group of individuals that want to do a paradigm shift and move from this treatment model that we're all addicted to a more preventative model. So if we wanted to make a difference in the lives of Canadians, in the lives of Albertans, we would have to challenge the healthcare delivery system in Alberta, for example, that consumes $16 billion a year. Every year in this province, we pay $16 billion that we can account for towards healthcare. And Dr. Plain could probably expand on that figure at some point later on. In Canada, it's about $220 billion a year. Year in, year out. When you put all the regional health authorities together, what do you end up with? You end up with Alberta Health Services, which employs more people than any other corporation in the province. 100,000 people work for Alberta Health Services. I don't know about you, but I sort of say to myself, how come we can't get it right? And the reason we can't get it right is there's too many vested interests that aren't working for the common good of your typical Albertan. Now, those are powerful words, and I'll debate anybody any time of the week around that. But there are some things that we can do. So we are poised to, I think, lead the country, probably the continent, and possibly the world in a new way of delivering healthcare. Our focus should actually be not putting the patient at the center of care. Our focus should be on getting rid of the patient. And every time I say that, I get pushback from my colleagues. How can you say such a thing? Well, the reality is, I've yet to meet a sick person that wants to be sick. Some do, but you know, the majority of people don't want to be sick. And so why don't we help them not to be sick? I asked my graduate students at the university to start with a blank sheet of paper, and there's no disease in Alberta as of midnight tonight. There's no cancer, there's no mental illness, there's no injuries, everybody at midnight tonight is going to be perfectly healthy. And then I say, what would you do to keep them perfectly healthy? Design a society that would keep these individuals perfectly healthy. And if they've listened and done their homework and research, the last thing they would build is a healthcare system. The first thing they would build is rediscover that beautiful thing that used to be called family. That family unit that realizes that a child growing up needs about 40 or so adults to come in contact with to be a wholesome child. So do we have that today? No. Our formula has been totally reversed. We'll put 40 kids in a classroom with one teacher and then wonder why things aren't working. The good news is we have the same curriculum across the country. Because no matter where I talk in Canada, I ask parents, when your kids came home from school today, and you ask them, how was school today? Boring. What did you learn? Nothing. Well, at least the curriculum is the same across the country. It's standard. Because we know that the way we educate kids is not the way that kids were designed to learn. Our education system was based because Carnegie and his buddies needed to have people industrialized so that they could work in industry factories. That's why kids have to line up in rows. That's why there's one teacher that barks out the orders. Trace how we came about with this education system. We know that kids are pre-wired to be one of 8 different things. And Switzerland has figured this out. And they identify very early what their youngsters want to be, and then they move them into apprenticeship models. And only 20% of people in Switzerland actually go to university. And those are the 20% that are wired to go to university. The rest are taken care of from a very young age, integrated, and given the opportunity to provide meaningful contributions to society. So the article that I gave you is an attempt to try and see how we can re-engage physicians in the process. And I think that if anyone is going to try and turn this healthcare paradigm around, physicians have to assume a leadership role. Being a physician is one of the greatest honors that society bestows on you, and you shouldn't take it for granted. And so in that article, I say 3 things need to happen. We need to improve governance. I quite frankly think we have lousy governance in just about everything we do within our society. Our governments are not as efficient as they could be. Our bureaucracies are not as efficient as they could be. And just look at your organization and ask yourself, are you happy with the governance within your organization? There's a skill and a science to governance, and we don't teach it. And so we assume people will pick it up by osmosis. The second thing is difficult conversations. As humans, we don't know how to have difficult conversations. If I was to say to Les Hagan, who's a good friend of mine, Les, you're the ugliest looking, lousiest, you're just a useless individual. Les's reaction would be one of three. He would freeze, not knowing what to do. He would run away, or he would stand up and give me something that's just as terrible, and we would get into a fight. We don't know how to have conversations. Difficult conversations are difficult to have. And so as a society, we don't know how to have the difficult conversations that need to be had. And the last thing that we need to get our physicians to do is to accept the fact that we have to have far more rigid performance measures for the $16 billion a year that's been entrusted in us. Unless I go out of my way to kill someone or do something terrible, I rarely get feedback on how I'm performing. Rarely get feedback. And I've been practicing for 20 years. And I don't think anyone in healthcare gets that much feedback. We want feedback. We're high performers. That's why we went into it. Every other industry out there, you know, I delivered 2 boxes to Ottawa by FedEx, and I was able to track those boxes by the minute, know exactly when they got there, and FedEx was tracking those boxes and finding out if they made money with them. When my Mac computer broke down the other day, all I did was I went on here, made an appointment to the Southgate Mall, showed up on time, they visited me, had my patient, diagnosed my patient, and returned it within the next day. And I could track it all on the internet. And yet in healthcare, we barely know what the heck's going on in our healthcare system. So I think with that as an introduction, I hopefully have stimulated your pancreas to start the digestion process and engage you in a conversation. I'm a firm believer that if you've got 2 ears and 1 mouth, you should be listening at least twice as much as you're speaking. So I want to listen to your questions and offer some pithy starting points as to where we need to go. So I'm happy that we have a $6 billion deficit, because maybe now we'll actually start thinking about how we can start saving some of that money and preventing $16 billion from having to be spent each and every year. And I encourage you all to go back and read that Senate report. If you want to have an excellent speaker, you should think at some point of bringing Senator Key on to talk about that report, because that report is the way forward. Unfortunately, it's gotten lost in it. Is that good, Les?
Sounds good to me.
Okay. So I'll take any questions that you have, any comments, any contributions.
Also,
Good question. Do you think people would pay more attention?
Do you think people would pay more attention if they had to pay healthcare premiums? Well, I don't think so. And the reason is that we pay right now enough taxes that go directly to the cost of healthcare. The trouble is that people don't link that all together. I remember when I first moved out here, I think it was the early 80s or 90s. Remember when they used to send you at the end of the year that bill? It wasn't really a bill, but it showed how much you actually used within the healthcare system. It makes a big difference, doesn't it? So I think what we need to do is make sure that right now, there's no exchange of money right now, right? Doctors get money, but it doesn't go through the patient, it goes through the government. It's a very mixed up way to do it. If we actually started putting a cost on everything we do, and we actually start putting a little more efficiency into the system, then I think people will accept it. But private healthcare is not the way to go, because anytime you look at private healthcare is good for people that want to make money. In the United States, that's private healthcare. It's been documented that 30% of that is totally wasted. And we know that private for-profit long-term care facilities offer inferior care to community-based non-for-profit long-term care facilities. The evidence is outstanding. So be very careful with the people that want to lead you down the private. The private is not the solution. Publicly funded, properly administered, properly measured is the way to go. But before you go there, get into the population and make absolutely sure you get rid of poverty. Make sure you increase the literacy rates, and that you take care of the things that really have an impact on people being healthy. And for you sitting in this room here today, you know, whoever took care of you for the first 18 months of your life did a very good job. Because the first 18 months of life pretty well determine what's going to happen to you for the rest of your life.
Dave,
all right.
short question.
Of course. Well, I heard a mention of the tobacco. What about alcohol and alcoholism?
Oh, alcohol and substance abuse, and some of the greatest drug pushers out there are the healthcare profession, unfortunately, right? So pharmaceuticals are very good when used properly. Unfortunately, not all pharmaceuticals are used properly. And substance abuse within our society in Alberta is a major problem. Actually, gambling and alcohol sales generate more revenue than royalties from the oil industry. The province receives more money from gambling and alcohol sale revenue than it does royalties from all the royalties that we have out there. Major problem. When I work in emergency, 60% of what I see is directly related to either smoking or substance abuse. Major problem. Then I'll show you how major it is. Anybody in this room know anyone that has a substance abuse problem? Put up your hand. All right. Make the questions faster and harder.
In terms of illness, it seems to me that the work environment is deteriorating more and more. We're so hung up on the bottom line that we forgot the human side of it.
Yeah. So the question is, the work environment, is it good or bad? Work environments, companies that understand how important it is to have a well worker are the companies that are very profitable. And that's why a lot of companies right now are really starting to emphasize wellness. So you're absolutely right. You can put a direct dollar figure on profitability and wellness of the individuals.
I unexpectedly heard you say one time that what is or something else to hire more police.
Yeah. Well, I think that a police officer can save far more lives than a general surgeon or a trauma surgeon ever can. Because Sweden, just to give you an example, in Sweden in 1997, Sweden said that by 2050, no one is going to be injured on a Swedish roadway. Sweden now has a fatality rate of 3.7 per 100,000 compared to Canada, which is close to 10. So I always say, I can charge a police officer with practicing medicine without a license if they go out and do traffic enforcement, because they will save far more lives than any of us. Well, I trained to be a surgeon, but I left early enough to try and make a bigger difference. And Dr. Yakimitz was one of the best teachers I ever had.
You know what, I'm fairly painful medical profession because there are many progressive thinkers, yourself included, but I wonder if you might comment on two aspects of the medical profession that deal where doctors or physicians seem to generate a lot of resistance. One is the devolution of some of the responsibilities of nurse practitioners, pharmacists, and the like. And the second is the area where the second is quite separate, but the loss of being a sole source of expertise with the growth of the internet and the growth of the increasing ability for people to travel to other countries to obtain, medical services at lower cost with high degrees of expertise. Those are two real challenges we're facing the physician community. I was wondering if you could comment on where that mindset is and what's being done to prepare doctors for that future.
Yeah, and the Canadian Medical Association has a blueprint called Healthcare Transformation, and they would agree with you 100%. The old days of having doctors, nurses, paramedics, respiratory techs, nutritionists, pharmacists, those days are gone. We have to learn to work in a team, and I can predict that the team of the future will be that IBM computer, that really smart computer, what's his name, Watson? Watson will be able to make diagnoses like that. Senior physicians will be able to sort of verify and say, Watson, you got it again, you're a pretty smart guy. And then teams will take care of those individual patients. So I think the days of doctor, nurse, you know what I'm saying? Those days are gone. We have to work in a brand new environment. And it's good to see that physicians and our nursing colleagues are thinking that way and leading us into an entirely different thing. And as a matter of fact, there's a lot of studies that show that you don't even need a doctor or a nurse. All you need is a healthcare worker. And that healthcare worker, all they need is to have good people skills. Smile, shake your hand, make you feel that you're special, and that has a very positive effect on you. So I think the times are exciting because that article shows you we got to start thinking very differently than we thought in the past. And universities have to reinvent themselves. Universities used to work when the professor had the textbook. Nowadays, those whippersnippers are so smart, they goat you. They ask you the toughest question. So I learned now to have an iPad there, so as they're asking the question, I Google it. So I can look equally as smart as they are. Honestly, we've got to reinvent healthcare, but we've got to reinvent our education system too.
We had a speaker here several years ago in Ottawa who was responsible for improving technology within medical profession. And he was going on and on about technology. So I told him that I was ministering at the meeting with me, is your doctor a good or bad doctor? And they say yes or no, and I say, what makes your physician good or bad? Whether he or she listens to me and has a conversation or sees me. Are we training doctors for those difficult conversations?
That's the first thing I teach my students. I say, look, I'll teach you how to not get sued. And you go in the room, my standard line is, doesn't matter how they look. Hey, good looking, what's cooking? I use that on everyone, male or female. They get smiling, then you apologize for the wait, tell them you're not going to charge them extra for the wait. And then you ask them, what do you think's wrong with yourself? And by then, they're just laughing, and then the students go, oh my gosh, they were so mad a second ago. No. Patients that like you won't sue you, even if you make mistakes. And we have to reintroduce that element of being a physician is one of the greatest honors that society bestows on you. Don't waste it. Don't waste it. So you're absolutely right. We've got to rediscover communication, especially the difficult conversations. Yep. Tomorrow. You give me $1 million, I'll give you $22 million in return, but you got to give me control of the law enforcement agency. Australia was able to show a $22 return on every dollar invested in traffic safety, and the return was immediate, and they also got a 25% reduction in crime, because the more cars you stop, the more criminals you'll catch, because 90% of all criminal activity involves a motor vehicle. So in tobacco, Les can talk about that, but there are some areas where your return will be almost immediate. The trouble is, the political cycle runs in 4 years, and it's very difficult for politicians to think beyond 4 years. As a matter of fact, it's very difficult for them to think beyond like 1 or 2 years, because there's always some crisis going on. But the evidence around the world is overwhelming that you will always get a far better return on your investment in prevention than you'll get in treatment.
2 more questions.
We're just getting started.
You've got a plane to catch.
Yeah. No, but it's very simple to solve that problem. Tax fast food. So you buy a hamburger, there's an extra $1 that's tagged onto it to go to the Wellness Foundation. All kids should be bused to school and dropped 3 kilometers from the school. And they walk the last 3 kilometers. And the thing you need to know about eating is, don't eat till you're full, always stay hungry, and chew your food 40 times, get 7 hours of sleep at night, don't eat after 6 p.m., and if flies don't like the food, you shouldn't like the food either. I'm serious. Yeah.
Well, okay, well.
At the very beginning, we spoke about schools and education and people to learn. All the very community, myself and many people here, started life with an undertaking in one of the schools with my group reduced to 14 students, 6th graders, 1 teacher. And everything I started in life to help my class. And what really bothers me is my grandchildren don't know as much about Canada or anything that I learned
So we should look at this. Yeah, so we should look at this as an opportunity to reinvent our society. And what, in closing, I started by saying we live in one of the richest provinces, in one of the richest countries. And as we do that, let's not forget the fact that 80% of the world's population lives in poverty. Right? 80% or so of the world's population lives in poverty. So we not only owe it to this province to free up resources, but we need to start thinking about how to transfer those resources offshore. And the simple act of going offshore and volunteering and doing something is going to make you healthier as well. That's why TELUS really encourages volunteerism. Because the things that make you happy are volunteering, strong social support. Happiness is 50% genetic. You can only get happier 10% by buying stuff. And this is spring. Look at your house. Look at all the junk you got in your house. And all that junk is stuff you bought to try and make yourself happy. I've been cleaning my house, and I feel so happy getting rid of all that junk. Thank you.
Thank you very much. That's one of the more entertaining and if you like guest involvement and member involvement in luncheon that we've had for many years. So we'll keep you on the list and try to twist your arm and get you back here more often to sort of get us stimulated again. I'd like to ask our archivist, past president, honorary director, Mr. C. Canadian Club of Edmonton in many ways, Jim Lockhart, to thank our speaker. Turn it on, yeah.
Good thing, I'll turn it on. One thing I think Dr.
Luke.
Francis would have been pleased of when he came in here was the low hum of the visiting. He said one of the things would be community, and there was certainly a lot of community socializing going on when he came in here. The other thing I took from his talk is, as Charles Darwin said, either adapt or perish. And I think he gave us that message today. On behalf of the Canadian Club of Edmonton, we are going to award to the charity of his choice a check for his contribution today. Dr. Franchescetti. I apologize for that. Thank you very much.
You're getting Charlie horses here. And give it to the Literacy Foundation.
It'll go to the Literacy Foundation.
There's a couple of announcements. One is on March 20th dinner, we're going to have former Premier Ed Stelmach, and his topic is Alberta's next decade. I can hardly wait. It should be very interesting. I'd like to, at this time, also canvass our membership and see if we could build up our portfolio of piano players. Because while we're lucky to have help today, our musical director is not someone who can guarantee that he will be at every luncheon all the time, good, better, worse. And we need a list of sort of individuals that have those talents. None of that runs in my DNA, and I don't know how many others of the board of directors, if it does, they're not revealing it. But we do need someone or people that will help out when problems arise in that area. So don't hesitate, just please let us know. We have about 3 or 4 people that we needed to contact this time before they were successful. So, ladies and gentlemen, the Queen.
Glorious,
declare this meeting adjourned.